The urgencies are clear. The issue is enormous. This intersection between climate change, pandemic prevention, health has become, there's increasing recognition in the last years, but this is a really critical point. And if we're here in Geneva, it's for two reasons. The first reason is to really transform commitments into action. We've heard a lot and a lot of good news in the last month, including the climate conference in COP a few months ago. But now is the moment to really see how that's going to play out on the ground. And particularly when it comes to local impact with the most vulnerable communities across Africa and other nations worldwide. And then I think we're looking, secondly, at a shift on what you might call better finance, not just more finance. And this is the fact that, again, we have finance there, we have the partnerships there, we have people who are behind this momentum, but how do you get that in terms of smart investments into health systems of the future? Because this is, again, critical. People are dying every day because of the impact of this climate emergency on our health systems. And now's the moment to really make sure that commitment and that smart investment is transformed into reality.
So when we talk about commitment, what are we looking at? Are we looking at governments, international NGOs? Who is concerned?
So it's the Africa-Europe Foundation. We've had the possibility to monitor the commitments, as an example, between the African Union and the European Union during the last 18 months. And there's a series of commitments when it comes to health systems and investment, to health infrastructure, when it comes to facing the climate change, but also when it comes to other areas of cooperation that are critical here, whether it's energy, it's agriculture. But one of the issues in our international cooperation more broadly is the silos. We have to smash these silos. We have to look at this much more holistically. And I think what's great about what's happening today in Geneva, but we have to really seriously focus, is how we're breaking those silos. We're bringing together people who are working in the health sector, working in energy, agri-food, working in areas on climate policy. But we need them to come together. We need them to be much more focused on this question of investment and finance. How do we really unlock what we know is there to be able to get? So we're talking about finance and political commitments made by a range of member states, a range of international foundations, regional institutions, but all of them are recognizing increasingly, how do you get the impact on the ground? And I think that's where actors and partners like ourselves coming together can play a key role.
So the Africa-Europe Foundation aims to reset the relations between two continents. How do you look at the collaboration with regards to tackling global health emergencies?
Our view of the Africa-Europe Foundation, we were very clear. We were a young organization. We were created in the context of not just this climate emergency, but also the global pandemic. And the way that the whole vaccine access initiative played out for us was not at all acceptable. Again, we had people dying on the continent because of a lack of collaboration, a lack of real partnership. So if we exist, it's because we believe there's much more scope for a much better partnership between Africa and Europe. It can really have a positive impact on people's lives and societies. So the quick answer is that the partnership is not in good enough shape today. It hasn't really fulfilled, I think, the commitments it has as a collaboration, but the potential is enormous. We know that if we can build the right trust, if we can have the right conversations between Africa and Europe, we can be transformative, not just in terms of health systems between Africa and Europe, but also what it means for global practice worldwide, which is why I think it's been showcased at a meeting here in Geneva at the World Health Assembly. So this Africa-Europe partnership, in real terms, bringing together different players, private sector, civil society, young leaders, can be transformative. But we have to open it up, and we have to accept it hasn't been good enough as a partnership historically.